in the interest of time, I'd like to open it up to the committee. I'm sure that they have questions. And Liz, if you can help me identify those who have questions, either in the chat or by raising their hand, we can ask the panel to discuss those.
I'm happy to help. It looks like Jane has a question.
Yeah, so one of the speakers commented that her primary care provider could order a PFAS test. And I know here in North Carolina, it's not clear where people would go. And I'm wondering if some of the other speakers could comment on whether they feel that their healthcare providers, if they wanted to order a PFAS test, would know where to go.
Any comments from the panel?
Okay.
I suspect that there does vary by state, because I know our state health department in Colorado tests for it. Whether or not they advertise that to primary care clinicians or specialists, that's probably less likely. But I don't know if all states offer that, and I just know that Colorado does.
It looks like Kristen's unmuted. If you wanted to continue, Kristen.
I just wanted to say that when we first asked, we were told our only option was through the ATSDR or CDC, but we know that, what is it? Is it Vista out in California? Right, there was Vista and NMS had been doing it privately to the tune of maybe $1,000 all told, because you had to get your own phlebotomist. And so we had been amongst ourselves sharing the information with how to get that ordered. But if you were paying the whole thing out of hand, some people decided to do it and some people didn't. And a lot of people just can't afford that kind of bill. So we've been pushing, for the option for our state to get there. But right now we've just increased our lab capacity for water. So, blood's going to take a bit.
Aisha, you have your hand up.
Yeah. So I actually, the problem is we ourselves are communicating with each other to try to figure this out. There's no clear-cut answer at all that helps us with this. So I went to the specialist and they told me it was going to be out of pocket. Then when we went to our primary care, they said not a problem at all. And that was the start. The difference between the two interactions was actually puzzling me, because our primary care on Nantucket did not skip a beat, did not make it at all of an issue. And all she did was sign it off and said, this is okay, because our health insurance will cover it if the doctor says, or my health insurance, I think every person has to call themselves, but my health insurance says, if my doctor says that the doctor deemed that it's necessary, insurance will cover it. And then I called all of our other doctors on island, our pediatrician, our general surgeon, and our primary care, and asked them if all of them would do it. And they said, absolutely, not a problem. So it seems so easy, yet here we are. So that was one of, I think, a struggle we have. And
I just want to point out what Kristen said, that NMS will do the test. And so that's the private company that I've been sharing with primary care providers when they're asking. Laureen?
NMS has several tests with different detection levels. So as Aisha said, that we have this pattern in our states and interstate and across the nation of residents advising residents. So we really need this to be standardized, federally, because it's so important. The detection levels differ and the physicians have to know specifically what test. Here in New Hampshire, we had 3 amazing legislators last year who came out of our water group, who went to Concord to help fix this problem from a a state perspective, and they did great job. And one of the things they did is they got a bill passed requiring insurance companies in New Hampshire to pay for PFAS testing. So that opened the door to Quest Labs because, they like to bill things. That's what they do. They're a lab. So they stepped in and they started providing, offering PFAS testing. And evidently you can potentially go there directly and insurance is required to pay for it. So that sounds great. What I haven't had a chance to do yet is check with them about detection levels, because detection levels are important and the panel is important. We need the whole panel, tested for, because that's what we're exposed to. Thank you.
Alan, Chris Wyatt has his hand up.
Yes, Chris and then Alex.
I've got a question for Aisha in the way of prevention. Has your husband, as a firefighter, talked at all about, is there standardized training for the use of AFFF foam, and do they talk about PPE and they talk about potential exposure? Obviously, from those pictures, somebody had missed that if it was, but are you familiar with training? Is that an area that really needs some attention?
Unfortunately, it does. Actually, I had only heard about PFAS, all of this, all last year when he was diagnosed with cancer, and we looked into it. At that time, we weren't told anything about the gear. We're told that the gear is safe, that they are, the alternative short chain PFAS are safe, and there is no warning labels, nothing on the AFFF foam. So you wouldn't really know anything. And my husband and many of the firefighters are told in fire academy and by their superiors that it is like soap and water, suds, dish soap. That's what they're told. No training at all on how to use it, how to store it, what to do with it. None of it is told to them. And they're told that the short chains, the thing that they are told is short chain is safe.
Great. Thank you.
Alex?
Hi, thank you very much. This has been a really interesting series of conversations today. My question, I guess, is primarily for Kristen, and I'm asking this question as a naive general pediatrician. So you talked a lot about the value of testing and the importance of following individuals over time for epidemiological purposes. And I was just wanted to hear you to expand on what you consider the role of the primary care physician around testing. So if a child is tested, what would you want to hear back in terms of about the level, and what do you think that the pediatrician ought to do if the level is elevated, or even if it's not elevated?
Thank you. That is a really great question. If it were me, it is me. When it is me, right? What we need is to take a holistic view of the child. Are there any symptoms? Is there any disease that needs to be addressed? Does PFAS, if there is exposure, have any role to play with those? Is it something we need to keep an eye on? Is it not? This is the state of what we understand and what we know. These are the things we could look at if you want to, or we could do watchful waiting and, monitor and keep an eye, and yearly take a look, or every 6 months take a look and see how the numbers are going. Are they going up? Is there an exposure source we don't know about? Are they naturally going down because the child's getting bigger and the volume is getting larger, and so the PFAS is getting diluted? Do we donate blood a whole lot, and so it gets removed and new blood is made? That if we are monitoring information as a primary care anyway, right? It's all digitized now. When I go, when my mammogram is, when I took, if I got my cholesterol checked, right? If all this stuff is digitized anyway, it could just be I want my child, in the biomonitoring for PFAS. Click. And then once you do your annual, right, you do your shots for school, you do your checkup for school, you say, oh, you're doing this, we're going to order you a PFAS test, and we're going to check thyroid, kidney, liver, just the easy things, just to see. And if there's something that looks suspicious, we're going to come back and take a look. And if you have any symptoms that make us worry, we're going to keep in mind that PFAS are shaped just like fatty acids, except they have fluorine on them instead of hydrogens. And so they can get into everywhere. And Linda Birnbaum has that slide that shows you that they get into all these organs. And if you have symptoms, we're going to take a look. But that doesn't, here are your options. And these are what each one costs in terms of time, in terms of office visits, in terms of pain. And you make an informed choice together about how to approach each child's exposure. It's just one more. If your child has glasses, you make sure that they can see, right? If your child has hearing loss, you make sure that they can hear. If your child has exposure, you make sure that you are monitoring those things you know could be affected, and you keep an eye out for those things you don't know. And if you take the data the whole way, when those things that you don't know about come up, you've got the data. That's my recommendation. You're already taking all this digitally. Use it. That's my recommendation. I'm sorry. I don't mean to sound frustrated. I don't. It's just
no, that's helpful. Thank you.
Thanks to all of you. This has been a wonderful dialogue and some interactions. I'm going to turn it back over to Ned since we're at the end of the session.